Thank you, Premier. As the Premier mentioned, in Ontario, we have recently seen a rapid increase in COVID-19 hospitalizations. The latest evidence has demonstrated that while the Omicron variant is less severe, its high transmissibility has resulted in a larger number of short-term hospital admissions. Recently, we reported our highest number of cases ever, and this is expected to increase further in the coming days. This rapid rise of Omicron cases, combined with staff absenteeism due to Omicron infection and exposure, could result in the province's hospital capacity becoming overwhelmed if further action isn't taken to curb transmission. And as Dr. Moore has continued to say, as the evidence on Omicron continues to evolve, our pandemic response must evolve with it. That's why, effective Wednesday, January 5th, the province will return to a modified version of Step 2 of the Roadmap to Reopen. These time-limited measures will help blunt transmission and preserve our hospital bed capacity. Measures include reducing social gathering limits to 5 people indoors and 10 people outdoors, requiring businesses and organizations to ensure employees work remotely unless the nature of their work requires them to be on site, closing indoor dining at restaurants, bars, and other food or drink establishments while permitting outdoor dining with restrictions, takeout, drive-through, and delivery, closing select indoor settings, including theaters, cinemas, and museums, but permitting outdoor establishments to open with restrictions, closing indoor sport and recreational facilities, including gyms, and permitting outdoor sport facilities to operate with certain requirements. Retail settings, including shopping malls, will operate at 50% capacity, along with personal care services. And indoor weddings, funerals, and religious services will be limited to 50% capacity, with outdoor services limited to the number of people that can maintain 2 meters of physical distance. In addition, on January 5th, the province will reinstate Directive 2 for hospitals and regulated health professionals, instructing hospitals to pause all non-emergent and non-urgent surgeries and procedures in order to preserve critical care and human resource capacity in the healthcare system. These measures will be in place for at least 21 days, until January 26, 2022, subject to trends and key indicators, and of course in consultation with Ontario's Chief Medical Officer of Health. I want everyone to know this was not an easy decision. This is not the situation any of us wanted to be in. I know everyone is tired, especially after what was a tough holiday season. But based on the data, emerging evidence on Omicron, and what our hospital partners are experiencing on the ground, these additional time-limited measures are needed to preserve our hospital capacity as we accelerate our booster dose rollout. We are vaccinating hundreds of thousands of people every day, and I strongly urge everyone to please get your first, second, or booster dose as soon as you can. By implementing these time-limited measures, we will get through this critical period in January and continue our work to end this pandemic once and for all. Thank you.